And good morning. It is now February 27, 2024. I'm Dr. Deuk Majin. Our patient is here with neck pain, and he has two problems. He has a herniated disc at C6-C7, but he also has facet joint pain. So he has pain from the disc and symptoms from the disc as well as the facet joints. And the facet joints in particular that are bothering him are C6-C7. So we're going to be fixing those today. Correct? Everybody agrees? Now he's traveled to Florida from South Carolina, originally Louisiana. The first step is to numb up the joints, and then we come in with a we call the Deuk plasma wand, and we're going to essentially destroy the pain nerve that is causing the neck pain in the back of his neck. That pain nerve has a name. It is called the medial branch of the dorsal ramus. Medial branch of the dorsal ramus. Now this nerve is found at every single vertebrae, and it innervates the facet joints, and it transmits pain signals from the facet joint to the brain. So if you want to eliminate facet pain, you must destroy this nerve. The name for that destruction is called a rhizotomy. The traditional way of doing rhizotomies doesn't work. It's called an RFA. We used to do RFAs all the time at Deuk Spine. We've stopped doing them because they don't work. They last only a few weeks or a few months, whereas this procedure is permanent, and it's called the Deuk plasma rhizotomy. Shot. I'm using an X-ray machine to locate the targets. And the targets are, as I said, the medial branch of the dorsal ramus. How do facet injuries occur? They occur with trauma. People hurt their neck or their back. They get into a situation where they traumatize the joints, and basically, as a result of that, the joints become injured, they start to degenerate, the patients get arthritis. Arthritis is a degeneration of a joint, and arthritis is painful. So the patients who have the arthritis end up having pain and stiffness from that arthritic joint. Now, the past way of treating this in the past that works is a procedure called a fusion, spinal fusion. The problem is spinal fusion, you're going to lose movement in your neck. It's extremely aggressive. And who wants to lose movement and have a fusion of their spine when you don't need one? So the idea here is that we target the actual source of pain, which is the pain nerve, the medial branch of the dorsal ramus, and we destroy it. You see where the tip of that probe is? That's exactly where the nerve is, right there. So I will use the X-ray to find the target, and I will use my probe to destroy it. And that's called the Deuk plasma rhizotomy. It turns out right where we are, it's called the lateral mass. And the lateral mass is simply a bone on the side of the neck. The lateral mass makes up the facet joint. I mean, the top of the lateral mass and the bottom of the lateral mass, well, they make up the facet joints, okay? The facet joints are the joints that were injured. They're the joints that are causing all the pain. I'm almost done with this patient's right side. And it's going quite well. By the way, he's asleep because we're going to be doing his disc injury next. Apparently he had a lifting injury at work, right? At a gym, sorry. And that's how he hurt himself. It doesn't really matter, folks, how you hurt yourself. In the end, if you injure your spine, your pain is either going to be coming from a disc in the most cases or the facet joints. And we have a treatment for both. All right, let me see. I've just completed our treatment. And we're done with the right side. Next, we're going to go to the left. Then we're going to take this patient and flip him over on the table. We're going to do the disc afterwards. We'll give it a try. Be ready in case we need. Just don't open it, but.
Stand by, please. This right there should be in the machine, on the drawer in the machine.
Any questions from our audience, Henry?
No current questions, but we do have a comment from, forgive me if I mispronounced this name, Bijaya on YouTube.
Yeah.
And
Is it Y-A-Y-A?
Bijaya.
I was going to say, yeah, is something else.
No, but yeah. Bijaya said from YouTube, it is amazing the latest technologies for human beings.
Yes, I agree with you. And in spine, it's Deuk Spine Institute that's pioneering these technologies. We have a patent on this technology. We just received it last week from the United States Trade and Patent Office. And by the way, this same technology is being used in knees and hips and shoulders to treat arthritic joints. So if you've been recommended for a knee replacement, don't get it done. Come have this minor Deuk plasma rhizotomy. We're going to be launching our new site to teach patients about this technology. The problem that we encounter is that the companies that make the metal knees and hips, metal shoulders, all the implants, they don't like us because basically patients aren't getting any implants put in their body. With our treatments, it's natural. We're just targeting the actual pain nerve. We're not the first to do it. Other people used RFA, but RFA, again, doesn't work. It may temporarily help, but then it doesn't last. So patients have to come back. We're done with the DPR. This is called the Deuk plasma rhizotomy. And we did a posterior cervical. Now we're going to flip this patient over and do his DLDR. Next.
Sitting down, please. Thank you.
Good job.
Thank you, sir. Thank you.
All right, we lost probably 10 drops of blood, so it's relatively bloodless surgery. Any other questions?
No current questions.
So you've just watched a bilateral cervical Deuk plasma rhizotomy to treat facet joint pain in a patient who traveled here from South Carolina. He's had neck pain from the facets plus the herniated disc, so he's got two problems, facet joint pain and disc pain. Next, we're going to treat his herniated disc. So come back in about 20 minutes, and you'll be able to watch the Deuk laser disc repair to repair the annular tear and herniation causing neck pain and arm symptoms. Thanks for joining us.